Wong, what is advanced wound care exactly?
Well, advanced wound care is a specialty in medicine now that's fairly new that really recognizes that there are people who have problems healing, and it has developed many different treatments to help people who struggle to heal finally heal and avoid complications such as infection and amputation.
And these beds back here, I mean, we have some beds that everyone's probably wondering, what are these chambers back here? Tell me what these are exactly.
These are hyperbaric oxygen therapy chambers, and they are very similar to what deep divers use when they're injured or when they have to decompress, but they are used to help oxygen get into the body, and oxygen is a natural healer. It helps people heal, it helps fight infection, it helps people develop new blood vessels and decrease infection and inflammation, and that helps people heal. So it's one of the many therapies we use here at the hyperbaric oxygen therapies, as well as advanced wound care to help people heal.
And who are the specific people that would actually come in for this type of care?
Hyperbaric oxygen therapy is only one of the many things that we use to help people heal, but people who haven't healed within about 4 or 5 weeks after an injury, or diabetics who struggle to heal, or people with other illnesses that interfere with healing can benefit from advanced wound care and sometimes from hyperbaric oxygen therapy. And we use this depending on the patient and depending on how they're healing.
I know a lot of us get wounds and we're kind of embarrassed about them, and we tend to just hide them, and then they get worse, and then they become problematic. Is this somewhere that someone could come just walk through the doors if they had a wound like that?
Absolutely. We work with primary care providers, but a patient who is concerned, who may be a little embarrassed to talk about it, can just come in and make an appointment and come in without a referral, and we're happy to help them and see them and talk to them about it. Because yeah, when you have something on your skin, especially if it's been there a long time, it's embarrassing. A lot of times patients try to hide it. We once had a patient who had a sore on their leg for over a year, and it just wasn't healing, wasn't getting better, but actually it was a fairly easy treatment and fix, and we were able to help them and get them to feel much better.
And I know that we have a gentleman back here, but tell me how this oxygen really helps heal these wounds, because I know a lot of us out there in the public aren't quite familiar with how that works.
It's actually an old therapy, but it has new applications now that using these chambers we can increase the amount of oxygen in the body 100 times. And the oxygen increases the body's metabolism, stimulates new blood vessel growth, helps fight infection, helps them heal where they may not, and sometimes if they're not healing and they develop infection, they can lose limbs and have all kinds of problems. So this is a help to help them heal. If we can throw as many treatments at them and help them to heal, they'll avoid more complications.
And how often does someone come in for this?
Only about 15% of the time do our wound care patients end up needing hyperbaric oxygen therapy, but we are happy to have it available for those who do need it because it can be limb saving.
And have you had someone come in and actually have a limb saved after getting in one of these? Or
I do believe that's true, especially with diabetics. When they get a sore on their toe, it can lead to an amputation of the toe and then the foot, and then when a leg is amputated because the infection just continues, and then they can die of infection. And so, yes, I believe we have treated patients who have benefited greatly and perhaps saved their life, if not their limb.
And you're open 5 days a week, so diabetics, anyone with wounds can come in 5 days a week and just walk through the doors and hopefully see someone with this?
Absolutely. Actually, we have physicians here 5 days a week. They can always walk in and see a physician, and we treat wounds from head to toe. That doesn't have to be just on your foot or just on the leg. It can be anywhere. And a wound care physician will see them and be able to treat them.
And you guys are inside Cache Valley Specialty Hospital?
Yes, Cache Valley Specialty Hospital.
Easy to find and open 5 days a week. You take most insurances, so you don't have to have a doctor referral.
That's correct, but we definitely want to work with your doctor if you choose to have us know about that, and we'll communicate with them and work with them.
And it's easy. You come in and you sit. You actually get to watch a movie. It's nice.
That's right. The treatments, hyperbaric oxygen therapy treatment is painless, and it just basically you get to lay in the chamber, and it's wide open as you can see, lots of glass, and it's very, very safe, but can help tremendously. We also use it for carbon monoxide poisoning to help push the carbon monoxide poisoning away, help oxygen get into the body.
And do you see people that with that?
We do. Unfortunately, during the winter months, furnaces and heating machines always can produce carbon monoxide, and those accidents happen. We can treat them here.
Great. Thank you so much, Dr. Long, inside Cache Valley Specialty Hospital, the Hyperbaric and Wound Care Facility. Thank you. I appreciate you.
Thank you for coming.